So you want to get a facelift. Some things to be aware of, especially for that first week. So you're going to have a dressing on initially, and every surgeon will have some variation as to how long they want you to wear that initial dressing. But it can feel kind of bulky, it can feel tight. So that first night or two may not be comfortable. So pain medications can help get you through that first night or two. And so follow your surgeon's instructions. If it's 24 hours, if it's 48 hours, if you have a drain, if you don't have a drain, all of that's going to vary a little bit. The other thing is what to eat. You know, those first few days, probably softer food, so make sure you have things that you like that are on the softer side. Usually by day 2 or 3 though, you can pretty much eat what you want. Activity, although we don't want you completely sedentary after that first day or two, we do want you walking around. That can help mobilize fluids. Don't try to be too active, obviously, and you probably won't feel like it anyways, but in terms in general of exercise, that first week, really limit it to walking basically. By the second week, I tell patients you can start kind of building up your activity level, and typically by third week, you can really be kind of almost full speed ahead on that. That depends on if you've had some other things done at the same time. That may delay things a little bit. And then in terms of just caring for your incisions or wounds, often the best thing is just Vaseline or Aquaphor. That's going to help the sutures avoid crusting. It's going to help the epithelium or lining of the skin come together more quickly. And then if you've had any laser resurfacing at the same time, you're certainly going to want to use Vaseline or Aquaphor for those areas as well. Again, that's going to let that outer layer of the skin, the epithelium, heal faster. So we've talked about activity, we've talked about diet, we've talked about your dressing. And then the other simple thing is using things like arnica gel topically, which can help with swelling and potential bruising. Sleeping with your head elevated a bit those first few nights. That doesn't mean you have to be in a chair, but even an extra pillow, so you've got about a 30-degree incline. Cold compresses. Cold can really help those first 24, 48 hours. Cold basically causes blood vessels to constrict, which is going to limit the amount of swelling or edema that you get. So depending on where your dressing is, sometimes it may be something you're putting on your neck below the wrap. It may be something you're putting more on your cheeks. And then once your dressing is off, you may be applying it more directly into the areas of the facelift. So those are some pearls for that first week of healing. Obviously, you'll have specific instructions from your own surgeon, and you should always call your surgeon if you're having any concerns or questions during that initial week. But once you get through that first week, you get to enjoy the beautiful results of a rejuvenated jaw neckline. So if you like what you heard, please subscribe to our channel, hit the like button, or leave comments, and also check out our other videos, which will offer more insight to other surgical procedures that you can learn about.